Hey, if you're looking for a way to afford therapy on a budget, you're in the right place. I'm going to do a quick video on how to use your insurance, or if you don't have any, how to get low cost and possibly no cost therapy here in the US. So, first, let's just talk about if you do have insurance, you can check and see what your benefits are. So, if you have a physical copy of your insurance card or a way to access it online, if you call the member services number for your insurance, here's some questions you can ask them to see what your benefits are. If you don't like the answers you get to these questions, you can opt to not use your insurance. It's up to you. So, here's some questions you may want to ask. What are your mental health benefits? How can you find therapists who are in network? Is there a find a provider function on the website? And here is the most important question if you're worried about your money is what will I have to pay out of pocket for the following billing codes? So 90791, that would be the code for a therapy intake or your first therapy session. And then 90837 is for all follow-up therapy sessions, hour-long sessions. I say hour long, an hour can be about 53 minutes, or that may vary, but it's a therapy hour. Ask these questions, see what you find out, see if you want to proceed with insurance. And if you do, again, go into the find a provider function on their website or ask them for a list of providers who can help you. If you are in college, university, or certain companies can provide counseling at a reduced cost and sometimes no cost. So, first, if you are a college student, if you go to university, and sometimes even people in the community of these universities or colleges are eligible for free or reduced cost counseling, therapy, mental health services. If you have a local college or university, you can call them and see if they have a counseling center or training center for their graduate students and see what's available. Also, at your job, you can go to HR and you can see if EAP is an option for you. The Employee Assistance Program often will provide a few free sessions, and it is private from your work, so they will not know details of what you're talking about in session. So that's another option, going to HR, seeing if that is an option for you. Now let's talk about things that are available in your community. So if you don't want to go through insurance, you don't have school or work options, going into your community would be the next step. If you have, or you should have, a community mental health center in your area, you can just Google that, community mental health, and then your city and state, and see what comes up from that. Contact them, see what services they provide. Usually they can help you find low cost therapy or affordable therapy in your area. You can also call 211 or go to 211.org, similar thing where they will help you navigate resources in your community. And then lastly, USA.gov/health. So I included this because this is a way to find out if you are eligible for state subsidized insurance, health insurance, or maybe even Medicaid. Even if you think you're not eligible, it doesn't hurt to try and see, and you may be able to get therapy for free or highly reduced cost. Okay, let's say you've done those things, or those are not really for you. Another option is to find a reduced cost therapist. Now, these options here, you're not likely to find free therapy, but you can maybe find a therapist who offers a sliding scale. So offers therapy that is, reduced fee that may be more within your budget. One option is to find an intern. You can do this by contacting colleges, universities, or again, like your local community mental health or local private practices even, and see if they employ interns. Interns are master's level students who are working towards licensure. So they aren't yet fully licensed, but they are getting close and they are supervised by a licensed therapist. Often, practicum students or intern students will offer therapy either for free or significantly reduced cost due to the fact that they are students and they are trying to gain hours while they also help you. And some ways to find sliding scale therapists. You can go to findtreatment.gov/locator. It'll show you different options in your community. Also, psychologytoday.com/US. Not every single therapist in your area will be listed there. It's only if they are advertising there. But that's another way to find sliding scale therapist. And then there are websites like openpathcollective.org where all the therapists on that site do offer sliding scale reduced cost therapy. You want to make sure that you say what state you live in because your therapist needs to be licensed in your state. And then the other option is online therapy services like BetterHelp, Talkspace, and there's a lot of controversy about those kind of services. You can get good therapy there or legitimate therapy there, but you just have to be careful. So do that one at your own risk. Just want to give you a few tips here as you look for a therapist. You want to make sure the therapist is a master's level or doctorate level licensed therapist. And you will know that because they will have letters at the end of their name, L blank, 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 blank. So they will either be a licensed therapist, a licensed counselor, licensed psychologist, psychological associate, a licensed social worker. And so just be really mindful of that when you're looking for therapy because you may find a mental health coach or you may find a religious counselor. And while they may be very good supports, they may not be licensed in evidence-based therapy. So just be aware of that. Another tip, if you find a therapist and it's still a little pricey, you can ask that therapist, what can I do to reduce the cost of therapy? One option may be to shorten session time, so asking for a 30-minute session instead of hour-long. Maybe you can pay less by doing shorter sessions or sessions less frequently. Also, you can ask your therapist for resources or homework between sessions so that you're getting some benefit between sessions. Also, you can ask your therapist, hey, what can I do in between seeing you where I feel more supported or more educated on mental health? And if the therapist you find can't help you, ask who can help you. All right. Lastly, I just want to throw out some extra therapeutic support here. This is not technically therapy, but it would be little wraparound kind of services. So if you're not familiar with some of these, I'd encourage you to check them out. The first one is NAMI, National Alliance on Mental Illness. NAMI.org is a great site, shows you some other options as far as not only finding professional therapy, but also support groups, psychoeducation, things like that. Also, the DBSA, so dbsalliance.org for depression and bipolar disorders, and SAMHSA.gov, SAMHSA.gov has some resources. If you're dealing with substance abuse, codependency, any kind of addictive issues, check out Alcoholics Anonymous, Narcotics Anonymous, Al-Anon, which Al-Anon is for family members of individuals who have alcohol addiction. Celebrate Recovery, and there may be some other secular options in your area as well. Again, doing a Google for your area will be helpful for you. You can, of course, reach out to clergy, humanist organizations, religious institutions in your area. Just make sure you feel comfortable with them and that they are open about mental health and that you feel accepted. And if that's not the case, please look elsewhere or use another resource. Of course, the National Suicide Prevention Lifeline is now 988, and you can call them 24/7. And you don't have to be on the brink of suicide. You can be, just needing to talk to someone. Same thing with the crisis text line. Text hello to 741-741, or you can go to their website, crisistextline.org. You can chat there through a browser, or you can call, text them, and get some immediate support and resources right there. So I hope this has been helpful. Let me know if you have any questions or if you have other options you'd like for other people to know about as well. Thanks.